Amazingly, one study has found that by the year 2050, an estimated 50% of the United States population will consist of minorities. Unfortunately, however, today's healthcare model has shown persistence in both racial and ethnic discrepancies. These discrepancies can lead not only to a distrust in the American healthcare system, but it can also lead to unnecessary deaths and further health complications experienced by patients. Now, at one point or another, we have or we will visit some form of medical facility, whether that be a hospital, a physical therapist office, a dentist, or even a nursing home in the future. And I think that we can all agree that in order to have a positive experience, it is vital that the healthcare professional taking care of us takes into consideration both our culture and our practices. Now, our culture can consist of our different identities, such as our gender, our race, our ethnicity, religion, and even our sexual orientation. And our practices can consist of things such as our modesty claims, if we have any, such as whether or not we feel comfortable working with a healthcare professional of the opposite sex, any dietary restrictions that we have, including fasting, or any views that we have on Western medicine and healthcare, which should definitely all be discussed between the health professional and the patient. But overall, our culture definitely plays a big role in determining our preference towards care, especially in a clinical setting. Thus, I would like to argue that healthcare professionals should take at least one cultural competence class before beginning their medical career, and by doing so, the healthcare realm can flourish even more so than it already is. But firstly, I would like to clarify what I mean by cultural competence, and by that I mean a thorough understanding of different traditions that lead to effective communication and appropriate communication with those of other cultures. Thus, healthcare professionals that acquire and demonstrate this cultural competency can lead to not only a decrease in health disparities, but they can also lead to greater patient satisfaction overall, and it can lead to just greater general knowledge that is useful and applicable to daily life. So I want to start by talking about how this cultural competency in healthcare professionals can lead to a decrease in health disparities. And according to Junior et al. And the December 2019 edition of Education for Health, Change in Learning and Practice, international literature reveals significant health inequalities between white and black people, as well as men and women, explaining synergistic interaction among social, racial, and ethnic-based inequalities. Now, why these qualities exist can be partially, if not majorly, attributed to cultural incompetence of medical staff. Just a lack of understanding between different cultures and not being able to accommodate each one, which many may need accommodations, can just lead to overall health disparities in this area. But moreover, and in general, it is vital for healthcare professionals to ensure the happiness and well-being of all their patients. Thus, by accommodating patients based on their cultural and religion, this can lead to just greater patient satisfaction overall. It has also been observed by Junior et al. In the December 2019 volume of Education for Health, Change in Learning and Practice that discrimination related to race and ethnicity is also associated with worse patient experiences of care. And this is not surprising considering that every culture varies, and one culture's norms may be different from another and may lead to offensive situations by assuming what one culture is okay with. So without this cultural competency, offensive situations can occur that can definitely lead to tension between the healthcare professional and their patients. But overall, information regarding different cultures is useful and should be understood regardless of the career, especially with the growing population in the United States of minorities. One blog published in January of 2020 by Preemptive Love argues that cultural competence is important because without it, our opportunity to build diverse human relationships is almost impossible. It is very important to just understand what different cultures practice, and it's important to put yourself in the shoes of others and be able to have different perceptions on things depending on what culture or tradition you have, especially because of all the different identities that exist today. And again, the growing population in the United States of minorities, it is important to just be able to understand and familiarize yourself with different cultures and different religions. In summary, healthcare professionals that acquire and execute cultural competence can lead to a decrease in health discrepancies. It can also lead to greater overall patient satisfaction, and it can lead to greater general knowledge that should be learned anyways and can be applicable to daily life. Therefore, I argue that healthcare professionals should be required to take at least one cultural competency class before beginning their medical career. This is because an understanding of various cultures has never hurt anyone before. However, a lack of understanding and misunderstanding of cultures definitely has and will continue to do so.